Welcome, everyone. I hope you're having a splendid day. This PowerPoint will cover dietary supplements and over-the-counter drugs. We'll talk a little bit about the legal distinction between drugs and dietary supplements. We will look at the 1994 Dietary Supplemental Health and Education Act, and then we will go over different types of over-the-counters, stimulants or sleep aids, that type of stuff, as well as a few other things that relate to this topic. So drugs and food can be considered similar. So when people think of typical food items such as a loaf of bread or an apple, it seems unlikely that they would confuse those with drugs, such as prescription antibiotic or illicit heroin. Both contain chemicals that interact with the body's ongoing physiology, in one case to provide nutrients, in the other to alter functioning in some way desired by the user. But a huge class of pills, capsules, liquids, and powders that look like drugs and that many consumers think of and use in the same way as drugs is legally classified as food products. This is very important to the consumer because of substantial differences in the way foods and drugs are regulated by the FDA, the Food and Drug Administration. So let's look at St. John's wort for an example. The plant is a perennial shrub with yellow flowers and, like many plants, a history of use as a folk remedy. Many people take tablets or capsules containing St. John's wort for these purposes. Food or drug? Sounds like a drug, right? But both the manufacturers of these products and the FDA have agreed that these products are not drugs, but foods. Even though people take them not when they're hungry, but when they're seeking relief from depression, anxiety, or insomnia. The Food, Drug, and Cosmetic Act, under which the FDA operates, says a product intended for the use in the diagnosis, cure, mitigation, treatment, or prevention of disease in a man is a drug. So if the users and sellers of St. John's wort intended it to be used to mitigate or treat depression, shouldn't it be considered a drug? Back in a previous PowerPoint on the history of drugs, it was reported that when this whole process of regulating patent medicines began in 1906, the FDA was concerned about purity of the products and accurate labeling so that consumers would know what they were buying. Later, when issues of the accuracy of health claims arose, the FDA's primary focus was on the claims made on the label affixed to the product. And remember from the history of the drugs PowerPoint as well, that drug manufacturers have to demonstrate to the FDA before marketing the drug that the drug is, first of all, safe when used as intended, and second, it is effective for its intended use. Since 1906, the FDA has also been concerned about the purity and safety of food products and ingredients, but not with the efficacy. Food products contain some ingredients with no nutritional value, but other ingredients that may enhance flavor or simply provide bulk. If the 300 milligram tablet of St. John's wort contains some amount of the plant, then it's accurately labeled. With a drug, people would expect to know exactly how much of the active ingredient it contains. But with a dietary supplement derived from a plant, like an herbal supplement, people might not even know what the active ingredient is, let alone how much is in the 300 milligram tablet. It is possible that no amount of St. John's wort is really effective. The research evidence is mixed on this. And also possible that the amount contained in a given pill is too small in any case. In 1993, the FDA took two important actions. One was the approval, after careful study, of 7 health claims that food manufacturers could use if their products met certain requirements, such as foods high in calcium can say they reduce the risk of osteoporosis, and foods low in sodium can say they reduce the risk of high blood pressure. In 1994, both houses of Congress unanimously passed the Dietary Supplement Health and Education Act, DSHEA. The DSHEA made several important changes. First, it redefined dietary supplements to include a variety of substances such as herbs, amino acids, and concentrates, and extracts of herbs. Previously, the FDA had only allowed essential nutrients such as vitamins and minerals that were known to be required in a healthy diet to be sold as dietary supplements in tablet, capsule, or liquid form. Second, the definition of safety was altered so that the FDA could declare a product to be adulterated only if it presents a significant or unreasonable risk of illness or injury. Any ingredient being sold at the time the DSHEA was passed was presumed to be okay unless the FDA could demonstrate its risk. Third, while a dietary supplement still cannot claim to be a cure or treatment for a disorder, statements can be made indicating the supplement has a beneficial effect on some structure or function of the body or on well-being. The sellers do not have to prove these claims as they would for a drug, but they have to provide supporting evidence that the claims are not false or misleading. And finally, products running such statements must also include the following. This statement has not been evaluated by the Food and Drug Administration. This product is not intended to diagnose, treat, cure, or prevent any disease. So in 1994, the FDA first publicized serious concerns about products containing ephedra. Many of these products were used by people seeking to control their weight. 10 years later, in 2004, after the widely publicized death of baseball pitcher Steve Betchler, the FDA declared that products containing ephedra did pose significant and unreasonable risk and therefore were not to be sold. That it took 10 years to accomplish this action and that it was up to the FDA to compile evidence supporting the risks. These are indicators that the burden of proof might have swung too far away from the sellers and onto the FDA. Consumer Reports magazine has published a list of dietary supplemental ingredients that it considers to be potentially dangerous to consumers. The FDA has taken regulatory action against some of these, but most remain on the market unless or until the FDA can develop clear evidence that they present a significant or unreasonable risk of illness or injury. Following a report from the U.S. Government Accountability Office that proposed greater authority for the FDA to regulate dietary supplements, Senator John McCain introduced the Dietary Supplement Safety Act in February of 2010. The proposed law would have required all manufacturers of dietary supplements to register with the FDA and to provide complete lists of ingredients. It also gave the FDA authority to issue a mandatory recall of any ingredients it found to be unsafe. The dietary supplement industry mounted an immediate campaign against this increased regulation, and a month after this, Senator McCain withdrew the bill. St. John's wort has been used for centuries and was once known as the devil's scourge because it was supposed to prevent possession by demons. In recent years, its psychoactive uses have included the treatment of both anxiety and depression. There is limited evidence on the effectiveness of St. John's wort in the treatment of anxiety, but several studies have indicated some usefulness in treating depression. The FDA has raised concerns about St. John's wort's interacting with various prescription drugs, so people using it should notify their physicians. S-dencyl-lomethionine is a naturally occurring substance found in the body. As long ago as the 1970s, SAME for short, SAME, was tested in Italy for its effectiveness as an antidepressant. Researchers investigate the possibility that by combining SAME with approved antidepressants, a more rapid remission of symptoms can be achieved. There's been several studies that have been conducted that indicate it's approximately as effective as prescription antidepressant medications, but many of these studies have not been well controlled. Ginkgo biloba, the extracts from the leaves of the ginkgo biloba tree have a long history of medical use in China. It is not clear which of the Identified ingredients in ginkgo are the active agents, and it is not completely clear how effective it is for a variety of uses for which it has been proposed. The substance does reduce blood clotting, so it has been proposed as a blood thinner, which improves circulation. However, combining ginkgo with aspirin, which also reduces clotting, could be dangerous. The most interesting suggestion is that the ginkgo biloba extract might improve memory in Alzheimer's patients due to its presumed ability to increase blood circulation in the brain. Looking more at weight loss products, people hoping to lose weight are probably the biggest market for dietary supplements. This story can best be told by reference to Herbalife, still one of the largest marketers of dietary weight loss products. Founded out of the trunk of a car in 1980, many of the original products contained the herb mahuang, which contains ephedra, an amphetamine-like stimulant. None of Herbalife's products contain ephedra, which has been banned by the FDA, but at least some of those products rely on large doses of caffeine to produce the stimulant effect formerly obtained from ephedra. Over-the-counter drugs are self-prescribed and self-administered for the relief of symptoms of self-diagnosed illnesses. The FDA estimates that consumers self-treat 4 times more health problems than doctors treat, often using the OTC drugs. Americans spend over $23 billion a year on OTC products. The 1962 Kefauver-Harris Amendment required that all drugs be evaluated for both safety and efficacy. The FDA made the decision not to study individual products, but to review each active ingredient. So there were between 250,000 and 300,000 products, but only active ingredients were reviewed. And so there were fewer ingredients and products, as many competing brands contain the same ingredients. 3 standards for regulation. The FDA uses the acronym GRAS, generally recognized as SAFE, to mean that given the currently available information, people who are informed and qualified would agree that the ingredient should be considered safe. Safe means a low incidence of adverse reactions or significant side effects under adequate directions for use and warnings against unsafe use, as well as low potential for harm which may result from abuse. And then we have similar acronyms for the other 2 important concepts: GRAY, generally recognized as effective, and GRAL, generally recognized as honestly labeled. Effective means that there's a reasonable expectation that in a significant proportion of the target population, the pharmacological effect of the drug, when used under adequate directions for use and warnings against unsafe use, will probably provide clinically significant relief of the type claimed. The exact number of OTC products on the market is not known because they still come and go and change, but we do know that there are more than 300,000 and they contain fewer than 1,000 total active ingredients, now reviewed in over 80 therapeutic classes. To reduce confusion and make it more likely that consumers will be able to understand the labels, the FDA moved in 1997 to create uniform standards for labels with minimum print size topics in a consistent order: active ingredients, directions for use, and then warnings, and bold bulleted headings. The new consistent approach to labeling has made it easier to compare products and their ingredients. In 1938, Food, Drug, and Cosmetic Act established a classification of drugs that would be available only by prescription. A drug is supposed to be permitted for OTC sale unless, because of potential toxicity or for other reasons, it may be safely sold and used only under prescription. Sometimes the only difference between an OTC product and a prescription product is the greater amount of active ingredient in each prescription dose. More often, however, prescription drugs are chemicals that are unavailable OTCs. Until the FDA began its OTC drug review process, Once a new drug was approved for prescription sale, it almost never became available OTC. Neither the FDA nor the manufacturers seem to have much interest in switching drugs to OTC status. Drugs recently switched to OTC status include the arthritis pain topical gel Voltaren and a Advil dual action, combining the two acetaminophen and ibuprofen. So behind-the-counter drugs, in 2006, the revised U.S. Patriot Act included a federal requirement that OTC products containing pseudoephedrine be removed from shelves that are accessible to the public and be kept behind the counter. Many of the manufacturers reformulated their products to include the phenphrine instead of the pseudoephedrine under the current regulations. People who do ask for and purchase these products that contain it are limited in the quantities they can buy, and they also must show identification and sign for the purchase as well. The FDA allows stimulants to be sold to help restore mental alertness or wakefulness when experiencing fatigue or drowsiness. The only active ingredient that the FDA allows in OTC stimulants is caffeine. The FDA also outlawed OTC products labeled for any purpose that contain combinations of caffeine and ephedrine, and has taken legal action against several mail order distributors of such combination of products. The weight control products, apparently the FDA didn't think it would be dealing with such a product because at the time the use of prescription amphetamines for this purpose was under widespread attack. However, data was presented indicating that the PPA was safe and effective, and by the late 1970s, several products were being sold that contained PPA as their only active ingredient. There was a study that was done, or rather some studies that were done indicated caffeine could potentiate the appetite suppressing effect of PPA. And for a brief period during the early 80s, several of the products included both PPA and caffeine. So after the 1983 FDA ruling prohibiting such combinations on the grounds that they might not be safe, all products returned to PPA only. There was some concern about the safety even of the 75 milligram doses, with the threat being increased blood pressure resulting from sympathetic stimulation. Anesthetics, meaning without sensibility, have this effect by reducing all types of sensation or by blocking consciousness completely. The other major class, the analgesics, meaning without pain, are compounds that reduce pain selectively without causing a loss of other sensations. The analgesics are divided into two groups. Opioids are one group of analgesics, but this chapter primarily discusses the OTC internal analgesics, such as aspirin, acetaminophen, and ibuprofen. One classification divides pain into two types, depending on its place of origin. So visceral pain, such as intestinal cramps, arises from non-skeletal portions of the body. Opioids are effective in reducing pain of this type. Somatic pain, arising from muscle or bone and typified by sprains, headaches, and arthritis, is reduced by aspirin or other related products. The experience of pain varies with personality, gender, and time of day, and is increased with fatigue, anxiety, fear, boredom, and anticipation of more pain. Because pain is very susceptible to non-specific factors, studies have shown that about 35% of patients will receive satisfactory pain relief from a placebo. More than 2,400 years ago, the Greeks used extracts of willow and poplar bark in the treatment of pain, gout, and other illnesses. In the 19th century, the active ingredient in these preparations was isolated and identified as salicylic acid. In the giant Bayer laboratories in Germany in the 1890s worked a chemist named Hoffman. His father had a severe case of rheumatoid arthritis, and only the salicylic acid seemed to help. And in 1988, he synthesized salicylic acid and tried it on his father, who reported relief from pain without stomach upset. The compound was tested, patented, and released for sale in 1899 as aspirin. Aspirin, either in the gastro tract or in the bloodstream, is converted to the salicylic acid. Aspirin was marketed for physicians and sold as a white powder in individual dosage packets, available only by prescription. And in 1915, the 5-grain, 325 milligram white tablet stamped Bayer first appeared. And for the first time, aspirin became a non-prescription item. Several companies started manufacturing and selling aspirin as aspirin, and Bayer sued. What happened after this is a long story, but Bayer obviously lost, and aspirin is now just a generic name. Aspirin has 3 effects that are primary basis for its clinical use. It's an analgesic that effectively blocks somatic pain in the mild to moderate range. So aspirin is also known as the antipyretic. It reduces fever. And then last but not least, aspirin is an anti-inflammatory agent, and it reduces the swelling, inflammation, and soreness in an injured area. The therapeutic dose for aspirin is generally considered to be in the range of 600 to 1,000 milligrams. The maximum pain relief is experienced about an hour after taking aspirin, and the effects last for up to 4 hours. Aspirin is especially effective against headache and musculoskeletal aches and pains, less effective for toothache and sore throat, and only slightly better than the placebo in visceral pain, as well as in traumatic or acute pain. This is an antipyretic, which is a fever reducing, and action of aspirin does not lower the temperature in an individual with normal body temperature. Heat loss is primarily increased by vasodilation of peripheral blood vessels and by increased perspiration. More aspirin has probably been used for its 3rd major therapeutic use than for the other 2, and that's the anti-inflammatory action of the salicylates. It is the major basis for its use after muscle strains and in treating rheumatoid arthritis. Aspirin increases bleeding time by inhibiting blood platelet aggregation. 2 or 3 aspirins can double bleeding time, the time it takes for blood to clot, and the effect can last 4 to 7 days. There's good and bad effects to the aspirin. Its use before surgery can help prevent blood clots from appearing in patients at high risk for clot formation. And for many surgical patients, however, facilitation of blood clotting is desirable, and the general rule is no aspirin for 7 to 10 days before surgery. Aspirin will include the gastro bleeding in about 70% of normal subjects, and in most cases, this is only about 5 milliliters per day, but it is 5 times the normal loss. And in some people, the blood loss can be greater or great enough to cause anemia. The basis for this effect is not clear, but it is believed to be a direct eroding by the aspirin tablets of the gastric mucosa. The anticoagulant effect of aspirin has a potentially beneficial effect in preventing heart attacks and strokes. Reye's syndrome is something that is considered to be rare. In the early 80s, concern about the relationship of aspirin use to Reye's syndrome, a rare disease, fewer than 200 cases per year in the US. Almost all the cases occur in people under the age of 20, usually after they had a viral infection such as the flu or chickenpox. And in early 1986, it was reported that fewer parents in Michigan were giving aspirin to children for colds and influenza, and the incidence of Reye's syndrome had also decreased in Michigan. The Michigan study lends further strength to the relationship between aspirin use and Reye's syndrome. No one under the age of 20 should use aspirin in treating chickenpox, influenza, or even what might be suspected to a common cold. Aspirin has long been associated with a large number of accidental poisonings of children, as well as with suicide attempts. It has now been joined on the DAWN lists by its relatives acetaminophen and ibuprofen. And together, these drugs received about 100,000 mentions in the most recent Dawn emergency room data. The common cold is caused by viruses, and more than 100 have been identified. Two groups of viruses are known associated with colds, the rhinoviruses and the coronaviruses. Viruses damage or kill the cells that they attack, and these viruses are clearly distinct from those that cause influenza or COVID-19. The rhinoviruses zero in on the upper respiratory tract, at first causing irritation, which can lead to reflex coughing and sneezing. Increased irritation inflames the tissues and is followed by soreness and swelling of the mucous membranes. Many of us grew up believing that colds are passed by airborne particles, jet propelled usually through sneezing. Usually colds start by the fingers picking up viruses either from hand-to-hand contact or from surfaces that have been contaminated within the past few hours. To avoid colds, one should wash hands frequently as well as avoid touching one's face. Treatment of these cold symptoms, there's no practical way to prevent colds and no way to cure the infection once it starts. So why do Americans spend billions each year on cold remedies? But apparently it's in an effort to reduce the miserable symptoms. Modern cold remedies contain three types of ingredients: the antihistamines, the sympathetic mimetic nasal decongestants, and the analgesic antipyretics. The most common antihistamine to be found in cold remedies is the chlorpheniramine maleate, which is the most common nasal decongestant in cold remedies, which is now the fenfluramine. So wrapping up our PowerPoint for today is choosing an over-the-counter product. So by now, one should be getting the idea that thanks to the FDA's decision to review ingredients rather than individual formulations, you as a consumer can now review and choose from among the great variety of products by knowing just a few ingredients and what they are intended to accomplish. There are 7 major active ingredients to be found in different combinations in OTC stimulants, sleep aids, weight control products, analgesics, cold, cough, allergy, and sinus medications. I hope this has expanded your overall idea on dietary supplements and over-the-counter drugs. I look forward to sharing more information with you. Have a great day, and this is Dr. Mattson.